Hi everyone, welcome back to another episode of Be a Nurse They Said. My name is Lainey and I'm so happy that you're here. Before I get started, if you haven't gotten the chance to yet, make sure you subscribe to my channel. That way you can stay up to date on all my videos and shorts that I post related to being a nurse and being in healthcare. This week we're going to talk about on-the-job needed supplies as a nurse. Not only things to keep in your pocket, but things to have on hand just in case you need them. Let's start with the things that you should have in your pockets just in case you need them. Pens, a nurse's best friend. You can never have enough pens, especially erasable pens. These are so nice, especially on your report sheets. You can erase things that you don't need anymore or mistakes that you made. Having these on hand is super important. Next, dry erase markers, Sharpies, and highlighters. Always have these in your pocket. You want to be updating your whiteboards so your patient knows what's going on for the day and who you are. I love to have a highlighter so that I can highlight on discharge paperwork, important things that patients really need to know when they're going home. And then a Sharpie if you need to label anything like a specimen, a urinal, a collection container, whatever it may be, you have these in your pocket on hand if you need them. Good old alcohol swabs. You can never have enough of these. I could probably put 50 of these in my pocket and I still need more till the end of my shift because I'm just constantly using them throughout my shift for things that I need to do. IV caps and insulin needles. You can never have enough of these either. We're always using these to cap our IVs. Make sure you're using these. Don't just put the end of your IV into the Y port because that is not sanitary. We want to be using these white caps, blue caps, whatever color your institution has to be capping our IVs. You never know when you're going to need one. Insulin needles as well. We have so many patients with diabetes out there. They're going to have insulin ordered and it's nice to have a handful of these in your pocket just in case. Make sure you have a roll of tape with you. There's so many times I'm in a room and I need tape and I don't have it on me and then I have to go and find some. You're going to be using tape a lot, whether it's to tape a dressing, tape an IV, tape a canister so you can measure output. Always have a roll of tape on you. Another thing you should always have in your pocket is scissors and hemostats. You never know when you're going to need scissors. There's been times where I haven't had them in my pocket and I've had to run out and get them, and it's just a pain when you're not prepared already in the room. So carry a pair of scissors in your pockets. Hemostats are fantastic. You can use them for a lot of things you wouldn't even think of. One thing I love using hemostats for is on tight IV tubing. Some people, for some reason, put IV tubing together so tight, and there's been a lot of times where I've had trouble disconnecting it. So instead of having to toss everything and get all new stuff, if you put this around where you tie the IV type tubing together and you can turn what's connected to the patient, it's a lot easier to get that disconnected than if you just use your hands if you use a pair of hemostats. So there's a tip for you. And flushes. It's great to have these on hand again because you never know when you're going to need one. You have these in your pocket. You can flush an IV before you give an IV med, check its patency, whatever you need to do with it. Great to have these on hand too. While you might not always need these supplies right that second or during a shift, you might not use one of those. It's so nice to have on hand anyways, just in case you do, for one, but for two, if someone else needs one and you're in the room with them and you're like, hey, do you have an alcohol swab? You're like, yes, I do. Pull it right out of your pocket and give it to them to use. So it's just nice to have these things on hand because 9 times out of 10, you're going to need them at some point during your shift. Another supply it's important to have on hand is a pen light or some sort of flashlight. A lot of nurses I see have a flashlight attached to their badge. That's great. You're not only going to use a pen light or a flashlight to check someone's pupils, but you can use it when you're putting in a catheter and you need some visualization. You can use it when you're working night shift and you don't want to turn on all the bright lights. You can use your little flashlight to check output on a Foley bag, on an NG canister, whatever it may be. You have a little bit of a light so you can see what you're doing. Obviously, you're gonna need your stethoscope. We need to listen to our patients and auscultate their heart, their lungs, their belly, make sure we can hear what's going on in there so we can report it off to the next nurse or any abnormalities we report to the doctor. Just be mindful, and I'm guilty of this too, keeping your stethoscope or anything else around your neck, especially if you're with a patient that has behavioral issues. You don't want to give them any opportunities to wrap it around your neck and potentially hurt you. So I would wrap it up and keep it in your pocket if you can. That way it's still with you and easily accessible, but your patients can't do anything. Along with having anything around your neck, watch your badges. It's best to have a badge reel that's attached to your shirt. If you prefer prefer to have a lanyard around your neck. Just make sure that it's one that if it's pulled at, it easily detaches. That way there's no potential for your patient to harm you. Another thing it's important to have during your shift is a watch, whether it's one that you attach to yourself or one that you wear on your wrist, but we want to be able to count heart rate, count respirations, see the time, and there's not always a clock visible in the room that you can see, so having one attached to you that you can easily use is probably best. Have some sort of clipboard that you can attach your report sheets to, that way you can carry them around. A lot of nursing students that I see now have the foldable ones that you can fold up into 2 or 3 and stick in your pocket, which I think those are fantastic. Another thing that you might not always carry with you, but it's great to be mindful of where it's located, are these aroma tabs. I know some places call them Queasies, but these are really great if your patients are having nausea. You cut at the minimum or the maximum scent and it sticks right to the patient's gown. The aroma goes up and it helps them with their nausea and make them not feel sick. These are also really beneficial if you're going into a room with a not so great smell. I usually just do the minimum scent and then I stick it right to my scrubs. And then this way I'm smelling the aroma tab instead of whatever smell is in the room. As far as what to wear to be prepared for your shift, you definitely want to make sure you have comfy scrubs. You're going to be working 8 to 12 hours and you don't want to be in clothes that are uncomfortable. You also want to make sure that you have supportive shoes on. I recommend sneakers or some sort of Dansko or nursing shoe, something that you're going to be able to walk around in for 12 hours. Something that are easily cleanable just in case you get something on them. Sneakers you can throw in the wash. The nursing shoes you can easily just wipe off. Another thing you should wear is compression stockings. These will help with your blood flow. Even though you'll be walking a lot of your shift, you will be sitting at times, so compression stockings are a great thing to wear. Be sure to have water with you so you can stay hydrated, and healthy snacks because you want to also stay nourished during your shift. I talked about in my last video how to survive night shifts, so be sure to check out that video if you have not had a chance yet. But I talk about eating overnight and how it's not the best for your body, but you still need to stay nourished. So taking smaller meals and healthier snack options is probably best if you're going to be working night shift. If you're going to be working day shift, it's a little easier with the eating schedule, but you still don't want to bring something that's too heavy and you feel too full, because you're still going to have a long day and you need to be able to be active and get around and feel good. Ladies and gentlemen with long hair, please always keep a ponytail on your wrist. I know a lot of times I wear my hair down to work, but I always have a ponytail on my wrist when I go into a room to do patient care, because the last thing you want is your hair to fall in poop or some sort of other body fluid and it's not easily cleanable and you have to end up cutting your hair or really washing it to get it out. Just put your hair up before you go into a patient room, save yourself the trouble, and just always have one on your wrist ready to go if you need it. So all the supplies I just mentioned are essential to get through your nursing shifts. You never know when you're gonna need them. You never know when a friend is gonna need them. So it's nice to just have them on hand. You need them, you can use them, you can hand them off to somebody else. Just make sure you have them with you so that you can be successful on your shift and not have to come in and out of the room 20 times for supplies that you forgot. Thank you so much for joining another episode of Be a Nurse, They Said. Please make sure you like this video, comment what you thought, subscribe to my channel so you can stay up to date on all my videos and all my content. Also be sure to check out my Instagram and my TikTok account, Be a Nurse, They Said. And remember, don't just be a nurse, be amazing like I know you all are, and I'll see you next time.